Ladies and gentlemen, this is a story that comes out in sciencenews.org. Babies born in opioid withdrawal have unusually small heads. So that just goes to show you that doing opioids during the time of pregnancy is causing some sort of brain impairment. I mean, how could the baby come out normal and you're using a powerful narcotic the entire time you're pregnant? Something is definitely going to happen to the baby. So now they are seeing that it's some sort of brain disorder going on in these babies. Babies born dependent on opioids have smaller heads than babies not exposed to the drug in the womb. The finding published online December 10th in Pediatrics, raising concerns that the drugs are impairing brain growth during development, and it highlights questions about the safest approach to managing opioid addiction during pregnancy. Now, in this country, ladies and gentlemen, whether you're pregnant or not, when you're on opioids, they use a drug to treat a drug, and that's methadone. That's the biggest one they use in this country. So if you got a drug addiction, when they want to wean you off of opioids, they use methadone as part of the treatment for your opioids addiction. So you are being treated with, and what ultimately happens is these folks that take the methadone end up getting hooked on that. So that's what's used to treat opioid addiction. Pass the drug through. Now, these drugs go through the bloodstream and go straight to the baby. So there's no way the baby is not going to be impacted. Infants can become dependent on the drug in the womb and experience withdrawal symptoms after birth. Now, they said these babies end up in the hospital longer for drug withdrawal than any other baby. And they are the most expensive babies to treat. So, any other drug, they kind of get past it a little quicker. But with opioids, it takes time. So they literally have to keep these babies in the hospital. Now, I believe it was maybe around 2015, 2016 when I read this, it was saying that each baby cost around $75,000 to treat for opioid withdrawal. And I'm sure it's way higher than that now. I'm sure it's way higher. The disorder marked by excessive crying, tremors, and difficulty sleeping or feeding. It's called neonatal abstinence syndrome, or NAS. In a new study, researchers compared the head sizes of close to 860 babies born from 2014 to 2016, half with NAS and half from mothers who had not taken opioids while pregnant. Newborns with NAS had a head circumference nearly 1 centimeter smaller on average than babies not exposed to the drug, the team found. And of the NAS babies, 30% had especially small heads. That was true for only 12% of the babies without the condition. Wow. Wow. The smaller head is a possible sign of a smaller brain. The new work suggests that those of the NAS babies who later have learning and behavior problems, which I would assume definitely these kids probably will end up in special ed. Contributing factor may be the effect of opioids on brain growth and development, said neonatalist Jonathan Davis. But it will be essential to determine the actual impact of the smaller heads to how these babies are developing. Wow. Don't they almost sound similar to the Zika babies? You know how they talk about the Zika babies just constantly cry and they really don't sleep and they cry damn near around the clock? These opioid babies sound exactly the same. Wow. But will the essential, but it will be essential to determine the actual impact of the smaller heads on how these children are developing. The United States is marred in an opioid addiction plague, and even babies haven't escaped unscathed. The overall number of NAS cases in 28 states rose nearly 300% to 6 cases per 1,000 hospital births. That's actually a lot of babies when you think about it nationwide. According to the U.S. Center for Disease Control and Prevention, Vermont and West Virginia, states hit hard by the opioid plague, each reported more than 30 cases per 1,000 births in 2013. That's 2013. And remember, the addiction rises every single year. The researchers also found that 372 of the babies with NAS, or 87%, had mothers who took methadone. See, that also have to have some kind of impact on that baby's growth. You know, I'm wondering if it's just the head and not the overall size of the baby may actually be smaller than unusual, but it doesn't really talk about anything other than the baby's head. These drugs reduce opioid cravings and withdrawal symptoms without producing a high, and combined with counseling can reduce illicit drug use and the risk of dying from an overdose. Called medication-assisted treatment, the therapy, which can still lead to NAS, is recommended for opioid-addicted pregnant women. That's because it's generally thought that withdrawing from opioids while pregnant could harm the fetus or put mothers at risk of relapse. But the recommendation, Towers says, largely stems from 2 case studies published in the 1970s, which reported a stillbirth and fetus stress following a narcotic or methadone withdrawal, respectively. Wow. So that just goes to show you how long these drugs have been around. Studies since then have found that a gradual withdrawal from opioids, including methadone, during pregnancy did not harm the fetus, he said. Still, the treatment is the first step for pregnant women addicted to opioids. You have to get off the street drugs, Towers said. It's not pure, and it's killing people. But it should be a woman's choice whether to continue with medication-assisted treatment or to undergo a medically supervised gradual withdrawal, he says. If a woman doesn't think withdrawal will work, perhaps she struggled with the past attempt, or she partnered still uses drug, or her partner still uses drug, then maintain the treatment and maybe the safer course of action. The way I see it, this whole thing is very dangerous overall for the baby. You're talking about all these treatments and drugs going into your bloodstream, you know, over a 9-month period. You know how much damage this is probably doing to that fetus? This is terrible. With medication assisted treatment, we recognize it's not perfect, Davis says. The research community continues to look for safer alternatives to manage addiction and ways to identify the moms for whom a withdrawal from medication assisted treatment is safe, he says. I don't know. This treat a drug with a drug, especially during pregnancy. I don't care what they say. All of these drugs got to have an impact on the fetus. And so, ladies and gentlemen, you're looking at a generation of people that will probably have all kinds of learning disabilities and attention deficit behaviors, all kinds of behavioral issues when you really think about it, as they grow and become school age. You're going to see a lot of these children, like I said, end up in special ed because of what their mothers did during the time they were carrying these babies. But please tell me what you think. This is really deep. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I will see you on the next video. Peace, family.